would be presenting Opening Pandora's Box, the true identity of suspected ovarian mass. So just wait, huh? We'll start. Thank you. Start, please.
Good morning, everyone. I'm Dr. Reena Agarwal, second year postgraduate student, Department of Obstetrics and Gynecology, Department PTGNM Medical College, Raipur, presenting the case titled "Opening Pandora's Box: The True Identity of a Suspected Ovarian Mass." Adnexal masses constitute 8 to 10% of the gynecological presentations, with malignancy accounting for nearly 4%. Despite advances in imaging, diagnostic discordance remains a significant challenge, occasionally revealing unexpected pathology only during surgery. This case highlights how a case which revealed on clinical and radiological assessment to be ovarian malignancy, but it was ultimately different that was found during surgery. My patient is a 52-year-old female postmenopausal who presented with pain in lower abdomen since 6 months, fullness in abdomen since 4 months, and constipation since last 2 months. Her vitals were stable. On per abdominal examination, it was 18 week size mass, which was smooth in surface, irregular margin, firm and immobile. On per vaginal examination, the cervix was displaced anteriorly and pulled up. Uterus was 18 week size, firm to cystic mass, and bilateral fornices were obliterated. The patient's investigations were within normal range, and her CA 125 was elevated to the level of 229 unit per ml. USG findings were suggestive of neoplastic ovarian mass likely arising from the right ovary, size approximately 9 into 10 into 12 centimeter in size. Left ovary was normal. MRI findings revealed heterogeneously hyperintense with internal non-enhancing areas representing necrosis noted likely arising from the right ovary, displacing the uterus anteriorly and laterally towards left, features suggestive of neoplastic mass lesion of right ovary. Patient was then taken for staging laparotomy. Intraoperatively, it was found that 12 into 10 centimeter variegated appearance mass with adhesions arising from the peritoneum near the sigmoid colon. The mass was adherent to the peritoneum. Serosa of sigmoid colon was repaired, and bilateral ovaries and uterus were found to be absolutely normal. Histopathology report revealed mucinous cyst adenocarcinoma. It was observed that malignant ovarian mass turned out to be peritoneal mass, fragile tissue with adhesion to sigmoid colon, carefully taken care by reputed oncosurgeon on board, adhesiolysis done, and serosa was repaired. Concluding this, not all ovarian malignancies found on clinical and radiological assessment are truly ovarian in origin. Uh, Maintaining a broad differential diagnosis, intraoperative assessment, and on histopathological confirmation, we should go for the final diagnosis and management of the patient. Thank you.
What was the cause of endometrial hyperplasia? Endometrium means postmenopausal 10 mm. Endometrial thickness.
Sir, endometrial thickness could be increased in endometrial hyperplasia with atypia or without atypia in endometrial. We can suspect endometrial carcinoma in case of postmenopausal bleeding.
You have not done endometrial histopathology.
So patient was suspected to be ovarian malignancy, and since she is
Maybe ovarian malignancy. You should have during post-operatively. You should have done the endometrial biopsy also.
in the
histopathology, pre-operatively also you should have done. Post-menopausal endometrial biopsy you have not taken. It is 10 millimeter.
So, since the patient is postmenopausal, she was ultimately to be taken for total abdominal hysterectomy. So,
But you're suspecting malignancy, so it could be the primary could be endometrial CA,
Uh,
the primary
Why
thing.
you have not screened for endometrial?
No, but I think in the histopathology report they must have commented about the endometrium.
Yeah.
Was what was written about the endometrium?
endometrium.
That is the mass. That is about the mass.
What is about uterus and endometrial?
The histopathology of endometrium suggested it was normal.
Normal, okay. Not even hyperplasia.
What is the cutoff in postmenopausal endometrial thickness? Endometrial is 4 mm. So it is very high.
You are understanding what we want to say. Is this more than the normal? the endometrial thickness for her age?
Yes,
What is the normal cutoff? At
more than 7 mm.
4,
What
5, maximum 5. So so that is what sir was asking. That is what sir wants to clarify. So one thing on gross appearance, was the sigmoid and rectum normal from outside in the during laparotomy?
No, ma'am, sigmoid colon was, the tumor was infiltrating the sigmoid colon.
Okay, it was infiltrating the.
Yes, ma'am.
So because mucinous is, it must have arisen from the the mucous membrane, the endothelium of the. Yeah. Mm.
Part of the colon was removed. Where
Sir, the mucosa of the tumor was excised and the mucosa of the sigmoid colon was repaired. It, Mm,
Only
So see,
mucosal invasion.
only
देखो,
mucosal
So
invasion
it
was
was
there. So tumor was excised and a repair was done at the level of infiltration.
because see, it is a mucinous adenocarcinoma, so it must have arisen from the mucous membrane, which is inside the sigmoid colon. So it cannot be just in the wall. So what was the picture preoperative during the OT?
Anastomosis was done, not the colostomy was not taken for.
Now was a part of sigmoid colon removed, which had this mass?
Yes, ma'am. Sigmoid colon,
Colon,
small
part of
part
the
of
sigmoid
sigmoid
colon
colon.
was removed. Which kind? Okay. Can you say what happened to the patient after the OT? What is she receiving? Any adjuvant therapy, chemotherapy? How is she doing?
Patient is following up in radiotherapy. We
Okay.
have sent her for follow up in the radiotherapy department.
Okay. Thank you. Thank you.
Thank you.
Interesting case. Huh? The surprises at laparotomy. You'll find many in your lifetime. हमारे सर बोलते थे क्या लिम्फोसार्कोमा ऑफ द इंटेस्टाइन ऐसा मार्क्स देखते ही उनको आनंद याद आ जाता था और बोलते थे लिम्फोसार्कोमा ऑफ द
सही
इंटेस्टाइन
बात है. Dr. Rolshi, are you ready? Yes, please. So Dr. Rolshi would be presenting Menopause Matters, Small Lifestyle Change